Hello, everyone. Welcome to our webinar today. We're going to be getting started in just a minute. But while folks get logged in, I'd love to tell you about some upcoming webinars here at the center. On Wednesday, October 18th, we'll be having a webinar on design and safety, sizing considerations for personal protective equipment with Dr. Kaya Hobbs-Murphy in the Center for Health, Work, and Environment at the Colorado School of Public Health. On Wednesday, October 25th, we'll be having a presentation on The Future of Work is Now, first results from the California Work and Health Survey with Dr. Edward Yellen in the California Labor Lab. And on Wednesday, November 1st, we'll be having a webinar on wildfire smoke exposure and post-fire cleanup, mitigating hazards with Michael Strange, CIH. Our next ERC Industrial Hygiene webinar is going to be on Tuesday, November 7th, with Major Thomas Dominguez and the Rocky Mountain Center for Occupational and Environmental Health. For more about these upcoming webinars, you can visit us at coeh.berkeley.edu/aboutce. And on behalf of education and research centers throughout the country, it's my pleasure to present our Industrial Hygiene webinar series. This is a collaborative effort on behalf of each ERC's continuing education program and aspires to provide you with access to current research supported through NIOSH ERC programs. Thank you so much for joining us today. Today's presentation, What Does Total Worker Health Have to Do with Industrial Hygiene, is brought to you by Dede Montgomery, MS, CIH, and the Northwest Center for Occupational Health and Safety at the University of Washington School of Public Health, and the Our Good Health and Wellbeing program. A few housekeeping items first. You are going to be muted during today's presentation. So if you'd like to ask a question, I welcome you to enter it into the Q&A. We will save time at the end of the presentation to address as many questions as possible. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page within 5 business days. And all participants who logged in with their registration email for the full event live today will receive an email tomorrow with a link to the evaluation form that will qualify you for a certificate of completion worth 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. Without further ado, it's my pleasure to introduce today's speaker, Dede Montgomery, MS, CIH. Dede has more than 35 years of experience working as an industrial hygienist and safety and health professional. Dede is currently program manager for Our Good Health and Wellbeing at Legacy Health based in Portland, Oregon. This program is funded through a grant from the Health Resources and Services Administration to advance specific goals focused on improving employee and provider well-being, including adoption of the total worker health approach. Dede previously served as Outreach Core Co-Principal Investigator for the NIOSH-funded Oregon Healthy Workforce Center, worked as a consulting industrial hygienist, and was Regional Safety and Health Manager and Industrial Hygienist for EPA Region 10 long ago. She has a BA in Biology from the University of Montana and an MS in Environmental Health Sciences from the University of Washington, where she was an appreciative recipient of ERC support. She is a certified industrial hygienist and an active member of the Pacific Northwest section of AIHA, past president of the Columbia Willamette chapter of ASSP, board chair of the Oregon Young Employee Safety Coalition, and has completed terms on ASSP's Council on Professional Affairs and its Total Worker Health Task Force. Dede's well-being go-to outside of work is writing. She is both a blogger and published author. Thank you so much for being here with us today, Dede. We're really looking forward to your presentation.
Thank you, Michelle, and I'm very appreciative and thrilled to be here. Thanks for inviting me. Yes, I hail from near Portland in the Willamette Valley, for those of you that haven't heard that word before, and it's beautiful Willamette River. I'm really honored, as I said, to join you and talk about the total worker health approach and really what it has to do with industrial hygiene and its intersection with well-being. I think back to all the years in practice, and I appreciate this evolving recognition during my career of all these workplace hazards that perhaps our traditional safety and health programs may not effectively identify or address, and really our growing awareness of this. I'm glad that we've begun to be a bit more holistic in viewing the role of workplace safety and health, certainly than when I entered the workforce, which I'm not going to say what year that was, but you can do the math. I too also, though, appreciate the experience I've had working alongside occupational health researchers, folks from NIOSH, the National Institute of Occupational Safety and Health, and our professional associations like AIHA, ASSP, and AAOHN. And there's others, as we know. I really encourage all of us, just if you hear not much else today, to look for our interdisciplinary and really inter-industry connections. I know it's hard to do this, and yet I really believe we learn from both outside and inside our organizations, and same with industries. So as we continue to move along here, the objectives, as you can see, are up on the slide, and I won't repeat those for you, but I'm really reminded of our exposure in exposure sciences and the strengths that industrial hygienists bring this total worker health approach and its relevant concepts. Michelle mentioned I'm an ERC graduate quite a long time ago. And really, I think one of the best things I learned during those years, thank you, University of Washington, is to see industrial hygienists as part of a team. You know, working back then with occupational health nurses and physicians, and ergonomists, and even some wellness professionals. Really, in today's world, we need to expand that circle. We have, you know, our friends and colleagues in human resources, diversity, equity, inclusion. I've mentioned wellness, occupational health psychologists. I could go on. And this isn't to say that each of our organizations is going to have that expertise. But again, there's so much we learn with all of us. And it can be very, I think, feel complicated and yet critical to bring each of those insights into this piece as we try to look at this total worker health approach. And so we'll do bits of this today. And if you've ever heard me talk before, you know I will always start this out with the definition of the total worker health approach. It's really important that we get it, that we start at the same place. You've maybe heard me say before, there's no one size fits all. There's no one way to do it. And I definitely repeat myself frequently saying total worker health is not a program. It doesn't exist like, say, HASCOM or even your ergonomics program. What we're really looking at is an approach or a framework. And and I think the paragraphs of descriptions for total worker health sometimes can maybe either feel so overwhelming or unclear that it's really our role as industrial hygienists. And I would add to that, if you're an occupational health nurse or an occupational physician or a wellness professional, if you really kind of buy into this, it's our role to help folks understand what's unique about this approach. So again, we're talking about policies, programs, and practices. It's all this stuff. It's not a program. It's not a policy. It's made up of those things. And again, the big piece here is we're integrating. We are integrating protection, or that we might think of as traditional safety, with the promotion of health, injury, and illness prevention. And in the end, what we're really trying to do is advance well-being. And I suspect you know as well as I that we're talking differently about well-being since COVID, since the pandemic. Most people get it. We may not agree on how to foster it exactly, but we get it. And we get its impact on everything in our lives. I love this image, and I'll credit my very good friend and colleague, Liz Hill, who's with SAFE in Oregon. This image, I think, illustrates what's inherent to this total worker health approach, which is, again, safety at its foundation. And that's one of the key messages I believe we need to resonate. We're looking for opportunities to grow health. And if you don't like the term grow, you can choose a different term that means the same thing to you or your folks. But we need to remember we're really looking at improving well-being. Step back for a second and think about it. It's really difficult to have a high level of well-being if we feel unsafe. Whether those are worries about chemical or traditional safety hazards, around violence coming from within or from outside our workplace. We also need to understand the term total worker health, which is a registered trademark coined by NIOSH. it may not work for everybody. And thus, you'll see many organizations use something else to refer to this approach and implementing this approach within their workforce. And so live well, be well, safety together, and I could probably come up with a number of others. It's really looking at what's unique about your culture, your organization, your industry, and how do we do these things. Certainly one of the big things is that we are aware of this connection between work and life outside of work. With these migration of hazards, including stress or health-related, chronic health concerns, mental health, and they integrate between all these parts of our lives. I think about each one of us is going to go through a dip in our challenge, a dip in our life that really challenges us. And those organizations that can really best foster us, even during those times, are honestly going to really help keep us engaged in work. So we understand, how work, its stressors, challenges, and perks directly ties into our part in our communities. And it's certainly a social determinant of health. And there's others that have done such great work helping illustrate this in the examples. It really impacts everything from health-based opportunities and exposures, safety, our commute times, where we can afford housing or if we can afford housing, and financial stability. I think this too is maybe what in part makes the total worker health approach or framework feels so complex. It's kind of like, we can't do all that, so why start? And we'll get to that. We'll look at some examples. But we do know that by addressing these factors and prioritizing, starting small and starting where we're at, we can improve employee retention, productivity, and certainly foster safer and healthier employees in work. If we were in a room together, I'd ask you to raise your hand if you'd seen this document before. If you haven't, I would search it on your internet and download it if you're interested in total worker health. We know that said it already, there's no one size that fits all. Its approach, we need to really understand it's evolving, it's dynamic, it's not a program. For example, think about right now healthcare, which is the industry I work in. Think about the priorities, hazards, needs, and challenges. Think about construction. Think about high tech. Think about manufacturing. Very different priorities and challenges. And yet, what we do need to take away here, and why I advocate this short document, is that no matter where you are, to truly try to implement the total worker health framework, there's 5 key elements that really you have to take on. And no, you're not going to do them all perfectly right now. But certainly you can see each of these, and some of them, they're not going to be a surprise to you. We know we have to demonstrate leadership commitment to safety already and health. And so let's kind of grow that to understanding well-being, walking the talk, funding programs. All of that is, really critical. We're going to talk about some of these a little more specifically. So I just kind of want to lay these out there. But while each of these, what's I think is important is each of these need to be in place, as I mentioned. And it might be really easy for us to go out on, how hard work is, the huge challenges we face. And this is all very true. But I think we also need to remind ourselves of the positive power of the workplace. Just take one example. Think about what we sometimes refer to as the loneliness epidemic. How many people feel lonely in their lives? And think about the opportunity for social connect at work, where you feel respected and you feel supported and you feel like you can safely ask questions, all this psychological safety. And think about on the flip side of that, if I go to work and I'm shunned or I don't feel part of it or I'm never invited or I'm bullied or whatever those things are, I'm not really getting what I can get out of that. We know that research shows, and I know you know it anyway, you don't need to look at research to show the correlation between job satisfaction and overall life satisfaction. I've referred to the term well-being quite a bit. And there's many more elaborate definitions of this than what I put on this page. But I think if you close your eyes and think about what it means to me, you have that feeling. Maybe it's not happy, maybe it's being content, maybe it's being comfortable, maybe it's having some physical pain abated or mitigated, or knowing that you're doing the best you can do. There's so many different ways to look at this. But it's, again, it's really clear that, as I just said, people with higher levels of well-being tend to be healthier. Whoops. Oops, sorry about that. I didn't mean to do that. Apologize. Got a little carried away with thinking I needed to update my graphic. Okay, so I love this graphic from NIOSH and the RAND Corporation. It comes via their WellBQ, their well-being questionnaire. And I'm going to give you some links at the end if some of this is newer to you. And we're not going to go into much detail here, but what I like about this is this really helps us kind of visually understand, what do we mean by worker well-being? It's really characterized by, you can see that external context, right? The quality of life, but with respect to my health and work-related environment, organizational, psychosocial factors. It really encompasses mental, physical, emotional, and economic health. I mean, that's really what worker well-being is, but influenced by so many workplace relationships, resources. And so if you kind of look at more from a simplicity standpoint, these four quadrants, we can certainly know the policy environment affects my well-being, not just what the policies are, but are they implemented? Are they implemented fairly throughout? And what's my health status? What do I bring? And am I getting the supports I need to address the health challenges I might have? And that's, we're going to get to the piece around integration. Integration's huge here, and that's one of the elements I showed in the previous 5 elements. And it's probably one of the biggest challenges we have in so many workplaces. Integrating what we know from the safety and health side with, well, what are our EAP opportunities? Do supervisors know about them? And we'll come up with some more examples, as I said. What's my work experience like? How many hours am I working? Am I doing rotating shifts? What's my physical environment and safety like? What's my ergonomics status at work? And so many other things. And again, that's kind of that red section, that top section is where certainly we all have a certain amount of kind of expertise in that we can help share with that team. Okay, I'm going to back up a second here. How many of you ever get asked by people, what's an industrial hygiene? I've never heard of it before. And so let's kind of hone back in on industrial hygienists. And if you are an occupational health nurse or an occupational health physician or some other discipline, it's also important that you understand what it is that industrial hygienists bring to the table and how your skill set complements that. And it really overlaps as well, as we know. And so, I love, it's certainly an art and science. I probably wouldn't have stayed with this profession if it was strictly a science. We know that we anticipate, recognize, evaluate, communicate about, and we need to control those hazards. If all we're doing is identifying and never controlling, well, you've probably all been in positions like that. And it can be frustrating, certainly. But this is what we do. And then as we identify those hazards, we're looking at environmental stressors in or from the workplace. And I really think about how that's changed how we view that now. We're having workplaces where we have so frequently hazards coming from outside the walls or outside our workplace control. We have certainly in the West Coast and in the West, but it's everywhere now, wildfire smoke. You may have no control over that as an employer, but yet we need to protect our people from it. Similarly, stress that comes from outside, workplace violence that comes from outside. We really need to, up our understanding of so much. Injury, illness, and we're really looking at these stressors that can cause injury, illness, impairment, or affect well-being. And so this is what we do. What I really want to repeat is we're not saying that industrial hygienists need to be technical experts on all things total worker health, but we need to see where our expertise is relevant and, as importantly, learn to be really synergistic. I would say opportunative, is that a word? And collaborative with others to move in this integrated direction of improving work conditions and work life. And looking at the expertise brought from our teams that we kind of mentioned earlier, where that may be our occupational medicine and nursing folks, or diversity, equity, inclusion, wellness, HR, we have to be willing to collaborate and to change up how we're doing things. And maybe that's one of our biggest challenges sometimes, because we have overload at work too. And it's really hard how to focus our priorities. Just in speaking about hazards that may be new to some of us, we know that the top hazard faced by most US and really beyond workers is excessive stress. Stress coming from all directions. It increases burnout. It adversely affects health and relationships. Psychological stressors can be a cause of this, as we know. And so we're not experts on this topic, but we do need to at least have an awareness as to how to identify potentially, measure, or who in our organization to team with. Who's doing the surveys? How are they choosing the surveys? Are we having input in those surveys? And there's so many other pieces here that we could talk about that we don't have time to talk about today. But as an example too, though, we may not have control over, say, job security, but we do have expertise around work schedules or demanding work. And so really making sure that folks in our organization understand and are welcome to those skill sets we bring. And if you're in the consulting model, then really expanding what it is you bring and maybe even who you work with. Again, what you've probably heard me say before is safety is foundational to total worker health. And I think it's really helpful for folks with backgrounds like ours to understand what it would mean to expand our kind of traditional view of the hierarchy of controls into one that has been really applied to the total worker health framework. So on this screen, you see probably the traditional hierarchy of controls that you know and love on the left. That's that thing that relates to us saying you don't just put a respirator on somebody first, to something that's really applied a bit to the NIOSH total worker health framework. And I would encourage you to kind of think about a term that I think was new to some of us during the pandemic, which is that layering approach. In some of these hazards we're talking about, you may not have one thing you can do. You may not be able to eliminate a very top high priority hazard from your workplace, but you may be able to look at multiple ways of the layering, the potential controls. And I'd have you really think about that. And we're going to look at some examples. And so, again, we're reminded, education and encouragement is important. It's always important. Helping people foster personal resilience is important. But we know that in itself, especially with demanding work, that in itself isn't going to cut it. That is not going to keep people around. It's not going to help keep high levels of well-being. So let's look at an example. I have 3 examples that I want us to consider kind of this hierarchy of controls using, the framework that has been more identified to address the total worker health approach. And let's think of the first one as violence in the workplace. Sadly, we know this is increasingly difficult to address, and we have prominent risks in so many, if not most of our industries and work. And they're different. Where the risks come from are different. the struggles present in our communities are much more frequently showing up in our work, whether within our employees, within our public and community partners, or with our patients. Top issues like workplace or like violence really joins these other issues, as we mentioned, that, they can come from within, but they can also come from outside. And I think that can make it really overwhelming. Certainly, let's step back. How do we even know? Well, we need to conduct risk assessments. And that's really where I would just really push, our safety and occupational health colleagues, we need to be involved in those. We are the ones that know how to do this, and we may not know all aspects of it. We may not have all the information, but we are key, of course, in conducting risk assessments or job hazard analyses. And so, kind of we can learn here by expanding to other types of kind of integrative opportunities and really, really prioritizing organizational interventions when possible. So let's look at this. So on this slide, you'll see the hierarchy of control on the left. And then on the right, all I've put there are the 5 key elements to foster the total worker health approach. Again, remember, it doesn't matter what industry you're on. You can work in manufacturing, you can work in education, you can work in corrections. The point being that in order to really move ahead in this approach, make baby steps if you must. We're going to prioritize what our hazards are. We're going to prioritize what our needs are. And so these are the 5 key elements that we'll need to do. And so let's kind of imagine some examples here with this topic, keeping all of those 5 elements in mind. So certainly we're going to eliminate and reduce hazards and redesign work. Again, depends on our workplace. Can we reduce access? Do metal detectors make sense? Does bulletproof glass make sense? Can we restrict patrons and clients, or do we look at past history and educate or prepare our staff in advance? Do we offer distress protocols? And certainly, how does our EAP support foster or kind of integrate into this with other services? What about redesign? Panic buttons, buddies and 2-person teams. Now, this starts to get into dollars. This gets into costs. This is tough right now. And this is why, in fostering total worker health, though, we are prioritizing a hazard-free workspace. And we have to have leadership engaged. And no, we can't do everything now. So what do we start with? What's our 1-year plan? What's our 5-year plan? What's our 10-year plan? And then, of course, layering further down the hierarchy, we might need restraints, we might need PPE, and certainly we probably need training. In terms of the leadership commitment, are our workplace violence prevention plans really actively supported, or do they just sit on a shelf, or meet our maybe our federal requirements or state requirements? Can we increase staffing? Do we need more security officers? Do they need different training? What are the issues? And do we enforce policies on staff expectations when we're also looking at internal? Certainly internal civility and violence. And then we engage workers. And again, we know that it's the people doing the job that have solutions for us and that know what's hard about it. And they need to be asked. We need to be asked. And, it's one of the ways we can feel respected and trusted and valued in the workplace. And so, what are those surveys? Do we have town halls that are actually listening? Do we have listening sessions? How are our safety committees and our employee affinity groups being activated on this and really being given the opportunity to lead and make recommendations? And then always protect confidentiality and privacy. Our human resource partners need to be on board. Our EEO and ethics and DEI, we need to have working access with them. They are most likely our experts on some of this. Phew, okay, we're going to move on to another example. Let's do a similar thing, but let's look at a different example. What about fatigue or not enough sleep? Again, that's not traditionally, except in a very few industries, been something we focused on a lot. And yet we know that lack of sleep and fatigue leads to increased workplace accidents and injuries. It can negatively impact our health due to circadian disruption, decrease our productivity, and so forth. And so let's look at a few potential solutions here. And you could sit here and probably come up with 10 other things that might be pertinent within your workplace. And what I'm trying to do in these different ideas, thinking that layered approach, not one, maybe not all, but a mix. And so certainly at the very top, what is our scheduling like? We need to be 24-hour operations, but is there a better way to do it? Or, what are the best practices? What's our overtime practices? And we know there's a lot of strength in sleep leadership training. What is that? And how do we get our leaders to be supportive around sleep? Again, what are our worker ideas? I had a great opportunity to work with a frozen food company in Oregon, and they had such great success around looking at shift changes and suggestions coming out of their safety committee. Certainly, many people may not have ever thought that they could get services around apnea testing and other sleep disorders, and what a difference that can make in their lives. What about healthy food options for everybody, including our night and swing shift folks? We know that impacts health, and it actually impacts energy as well. It impacts our sleep. Evaluate the need for workplace napping. And yes, guidance and policies are critical here, or you can really start to create some problems, as you imagine. We want those to be equitable and make sense. And always reviewing what data do we already have from our injuries and illnesses, as well as, the survey data. And certainly always education and referral in this topic on sleep hygiene makes a difference. But on its own, if we don't change what some of the conditions are, we may not, in fact, have a lot of uptake on that. The third example, you could do this yourself, and I'd probably have you do it if we were in a room together. But let's, again, think about, we did talk about workplace violence, but let's talk about incivility and bullying. Okay, we know, and by the way, I give a shout out, go back to that picture, give a shout out to awesome work happening in Portland and Oregon and Washington in our construction and trades folks with some of their work on this topic. They're safe from hate campaigns. And I know there's at least a couple folks perhaps on this call that have experience with that. So again, what can we do? Well, think of the layered approach. What are our existing policies? Are they effective? Are they fair? Do they jive well with our EEO and DEI policies and intentions? What are our expectations? Are they and they enforce consistently at all levels and all teams to provide safe work for all? What's that management commitment again? What kind of information and training is being provided at all levels on this topic? Again, engagement. I'm going to sound like a broken record here, but we know this is critical. Survey data. Again, you see some similarities here. What are our resources? And again, these are somewhat generic. You could get way into more specific things based on your workplace, but what I'm really trying to illustrate here is that layered approach. My final slides here are really getting at practices that work. And I want to step back. I think sometimes we can make this look at total worker health feel very complicated, or see this example of different interventions here and here and here and here, and there's no way we can do all that. So I really would have you take away with from today these practices that work. Think about what you're doing right now and how you can grow them, how you can expand in them. Even think baby steps. Maybe it's a pilot. Maybe it's this one cool thing that's rolling out of HR, and you can expand it to better integrate it with other things touching well-being. But at the very bottom, we know we cannot really adopt the total worker health approach without integrating our relevant systems. And I really believe this is probably the trickiest and most difficult piece here, especially for large organizations. If you're in a small organization, this one might actually be a bit easier. I wanted to give a shout out to a project I'm just kind of finishing up as part of the grant I'm working on. I've been very grateful to be able to work with a consultant on this. But one piece, and you do not need to do the elaborate amount that we're doing within the system I'm working in, but what would a gaps analysis for not just occupational safety and health, but well-being look like? What are the gaps? What are your strengths and opportunities when you look at everything system-wide? And so how might you go about that? Well, certainly, no matter how big or small or, in depth you do this, you need an interdisciplinary team. What are your existing programs and policies? How are they working? Where are your conflicts and gaps? Maybe you do confidential interviews. People need to feel safe, but it's certainly a way you get at things that leadership or others may not know. Existing data, current offerings. So often we have a lot of cool stuff that's happening, but people either don't know about them or they're not tied together. Strategize on core organizational values. It's a big one. What is the message people are getting, especially in certain industries right now, like education and healthcare, probably also in retail. What do the frontline workers think? What is the message they're getting around safety? And then the bottom one, what are you identify priorities? You can't do everything. What's a realistic plan and a timeline? And maybe what you need are some easy wins. People need to get that you actually see this. So that's kind of one overall look at how we might start to figure out where to go. But back to some of these practices that work, some real takeaways. And I probably put too many slides. There's 3 slides here, and I'm going to go through this next 3 very quickly. But I really like to promote this article that showed up in Professional Safety, September 2021, by Miley Lynn and Rosa Antonia Carrillo, about micro practices. And this idea that you may have a lot of uncertainty and things happening within your organization, but your team, you can start to foster a safe space with some simple, but not always simple, micro practices that promote psychological safety. And so I'll just kind of share one from each of these slides, right? Give thanks and recognition. And do you mean it? Does it really mean something when you do that or when your leaders do that? Within the same article, there's some great tables and certainly there's micro practices to promote authenticity. Okay, I can share my story and emotions, and do I understand when the right time is? And I'm being helpful to know when the right time is to do this. Do I apologize when I need to? And other things that we can all learn to do better, and our leaders can be helped along in this. The third one out of this set is really promote belonging. Do we really feel part of our teams or our organizations? Are others really invited to speak? Do they feel safe to speak? And so again, I'd encourage you to check out this article if this speaks to you. Just a couple more slides on this topic. We know, and you've all had experience, right? How many of you have stayed at a job because of an awesome supervisor, or perhaps left a job because of a challenging supervisor? There's a lot that supervisors can learn, and there's some great work on something called supportive supervisor kind of training and education. And I would give a shout out here to the work out of the Oregon Healthy Workforce Center and Dr. Leslie Hammer, who you can kind of, if you probably Google search her or the center, you'll find some great stuff on this if you're interested. But there's certainly great evidence that our supervisors certainly can really help create and foster well-being. So I would absolutely check that out. And this is a great example of where you on your own, well, you might have to have some connections with HR to actually instill some of this within your groups. We know that there's some things we can do to reduce stress. And we may think, well, this person in this job has no control. There's nothing we can change up. And this is, again, engagement with the folks that are doing the job and remembering control doesn't mean, or autonomy, it doesn't mean I come to work when I want and I leave when I want. People understand, many people who can't work remotely, they understand I need to be there to do my job, but where is the flexibility? And again, I think in construction and actually a number of industries, we're starting to see there's some flexibility we can give folks here. Encourage people to care for one another. We, at our deepest, human heart, we want to be cared for, and we kind of want to care for others if we can be in a safe space to do that. So how do we do that? And these are all those soft skills that really weigh in on how we feel about our jobs. This is my nearly second to last slide. And so I feel like I've kind of ran through this. But what I kind of wanted to do is really just show some examples as to how, total worker health approach, it's a big package and beyond. I don't even know if it's a package. And on this slide are some of those key pieces we know that support this approach, but they need to come together. And we need to work with various team members and colleagues to really have the knowledge, the skill set, and probably the authority to do these things. And so I would encourage you to kind of think about just even the pieces on this list. What are you doing right now to build a safer environment, a healthier environment? Um, how is compensation and benefits? This is hugely challenging, and you don't have control over it potentially, but understanding the role this plays in well-being is really critical. I think that's enough on that slide. I'm going to go to two more slides. One of the objectives I did say was that I would, in fact, share with you additional sources of information. I think that total worker health is, if anything, overwhelming because there's so much out there once you start looking. And so I think if you're kind of just starting out and you have the background that I have, or you're from the industrial hygiene or really occupational safety discipline, this is where I would start. Certainly, NIOSH has a lot of information on this. I would particularly highlight here making the business case, if that's something that, I haven't even talked about return of investment and value of investment. We know that's important. They have a great webinar series and the recordings there, just like a lot of the ERCs and the Total Worker Health Centers do. There's a newsletter, a quarterly newsletter. I'd subscribe to that. The document I mentioned, I realize there we go. I'm a little bit, you can't quite see that clearly. Blurred was the word I was looking for. But I would go ahead and get that. You see it's listed under here as the fundamentals of total worker health approaches. And then really there's 10 total worker health centers of excellence that are funded by NIOSH to really do both kind of interventions and research, as well as education and outreach. And so you can get to all 10 on the NIOSH webpage. But I did list the ones that are in the West. I referred to the Oregon Healthy Workforce Center earlier that's based in Portland. They each have a little unique expertise, you could say. Certainly, I need to mention the California Labor Lab that's really, I think, focused on many things, including alternative work arrangements, and I would say decent work. That's shared, I think, between UCSF, UC Berkeley, and the California Department of Public Health. You'll see a number of others on here. And so just a little shout out to them and their publications. And then certainly our professional societies, I've listed 2 here, but I know certainly with AAOHN and others, there are certainly conversations around total worker health in various conferences and whatnot. And I think with that, because otherwise I'll keep listing too many resources. Again, I'm always happy to connect with folks. If you want to reach out to me, there's my email address. I hope to be at both AIHA, the national conference, and Safety 2024, talking a little bit about some of this. So I think that's enough, and I'll open it up to questions, which I think I can see some of them, but maybe you could read them to us, Michelle.
Absolutely, happy to. Thank you so much for this awesome presentation. Now we have plenty of time for questions. So if you have any questions for our expert, Dede, right here, right now, please go ahead and put them in the Q&A and we'll make sure to ask them. Um, First question, with climate change and extremes in temperatures, how are jurisdictions and firms addressing heat and cold stress and heat and outdoor workers? Is there a total worker health approach that you might recommend for that?
Oh my goodness, I knew I'd get really difficult questions here. That is such a great question. Yes, I think there are, in the sense that and they may not even be thinking about it. Let me back up. What I do know in Oregon is I even saw some of that when Oregon OSHA did its rulemaking on heat and wildland smoke, in that they invited public health to those rulemaking sessions and community health and community advocates. And I'll tell you, that was the first time, and I've been involved in a lot of rulemaking advisory committees over the past. And I think that in itself showed that need to partner. Um, and realizing that. But more specifically with your question, I think that what I would do is I would really go back to those pieces we did on the three examples I gave, with kind of the workplace violence as an example. And I'd really kind of just do a brainstorm, think about what are those different layered approaches and what would that look like? And it would be, looking at, absolutely more around the health side. What about, and we see that with some of our standards, right? People that have some of the chronic health concerns who are outdoor workers. What is the advice for them in terms of when to wear a respirator or not to be outside? And it's difficult. Ooh, let's talk about that another day. That's a really great question. Go ahead.
Awesome, thank you so much. Another kind of on the example front, do you know of any examples of total worker health measures for those in war-torn countries or folks with ongoing PTSD? Um, do you have any ideas around what might be a total worker health approach to address something like that, especially coupled with employees' reluctance to talk about those kinds of things?
Wow, that's huge. And that's so outside of my level of expertise. What I would tell you is it's a really great example of how we have to have connections with our psychologists and our mental health professionals, and people that have the real expertise already working with PTSD and those stressors, to help think about now as an organization, what are the pieces we have in place? It's not just enough to have an EAP. It's not just enough, supervisor training is huge here. And I think there's been some work out of Oregon with veterans that you might find really useful. So, and a huge piece in sleep, research around sleep and showing, PTSD and sleep, and what are some of the controls, not controls, but accommodations I can do there. These are awesome questions. I'm going to leave that, but thank you for bringing that up. But I think what it really instills in is this really need for interdisciplinary teams. We should not be the experts. In fact, I think there'd be some concern me saying I would know how to give answers on some of these, because it's not my expertise. So thank you very much for asking that.
Awesome, thank you so much. Are there any professional development certifications that you would like to recommend related to total worker health?
Oh my goodness, that's been quite a big conversation. So what I'll do is give you a couple options. First, shout out, I didn't mention CPH New, which is based at University of Lowell. that is one of those centers of excellence. And they have some great training they've created specifically for those in occupational health and safety. You can get CIH points, you can get CSP points, it's virtual. It's not really, I think at this point, there's not really a true certification that I'm aware of. Colorado, the Total Worker Health Center at Colorado also has, I take it back, there are some certifications that are weaved in through graduate programs. So I would look at the Colorado Center for Total Worker Health. And then where I used to be at the Oregon Healthy Workforce Center, we had created a Total Worker Health Alliance with some curriculum that wasn't a certification as much as a kind of a train the trainer. So you could go back to your organization and teach Total Worker Health a little bit. So I'd look at the Oregon Center also. And then finally, I would give a shout out to a new, I got to get the name right, the Total Worker Health Professional Society, and I'm sure they are having conversations on this topic as well. So that's what I know, and there's probably an update that I don't know. So thanks for asking.
Yes, I guess I'll just add, yes, I know there is a new society and they're actively looking at what does being a certified total worker health professional mean. So if that's a conversation that you're interested in, I'm sure that society is a really great place to give some feedback. I think they're actively looking at that right now. And I'll just say that there are a lot of NIOSH supported total worker health centers, and a number of them are developing continuing education
Yeah.
opportunities. So awesome.
Yeah, thanks. Michelle, I just add to that. Yes, thank you. And, I would really look at, there's different expertise from different centers, as I started to mention. And one I didn't give a shout out to is the Total Worker Health Center at Johns Hopkins, which is really focused, their strength is on mental health and substance use, and the workplace. So again, great opportunities, and most will record their webinars and so forth.
Awesome. Thank you. All right. What are your suggestions for supporting employees in an environment where job openings are at an all-time high and workplace hazards are also very high? For instance, in workplaces supporting violent patients with disabilities, living in congregate care supported by state and federal governments. There are workplaces where workplace conditions can be very hazardous when there are not enough workers. And it also seems there are workplaces where there are never enough employees in direct care roles.
Yeah. I don't know why, Brian, this one kind of almost makes me cry. Honestly, this is so hard. And I don't have answers, because what we know is that we don't have enough workers on certain shifts to be safe and to reduce the hazards. That's the bottom line. I mean, even when we talk about, reducing rotating shifts and overtime, in how do you do that if you need to use the same workers to do it over and over? And physically, I don't know that you can. And so I think what it means is that there are things we can do. You know, we can start to alter, parts of the day that we can have extra people help, for example. But unfortunately, it sometimes is going to take a really tragic thing to, in fact, then, allow us to increase that staffing. And so what I would tell you is we have to continue to work with those who understand that at the highest levels, that we just, you cannot provide a safe workplace in some of these conditions. And I'd love to talk to you off, another time on this, because it's really something that I've been giving a lot of thought to. So feel free to reach out. I think that was Brian. I'm not sure what the name was, but okay, thanks.
Awesome. Thank you so much. I really appreciate your attention to these questions. Um, do you think that successfully implementing a total worker health program depends on the general salary level of the workforce, i.e., a more skilled and better paid workforce, there's a higher likelihood of success?
That's such a great question. I think we have to think about what there's a huge, I think, what's the word I'm looking for? Disparity. Is that a word? Between kind of the haves and the have-nots at work right now, in terms of, we've seen it with remote work. If I am working 2 or 3 jobs to support myself, because that's my wage, and I'm have no family time or no personal time. It's almost impossible to get my sleep, to have a high level of well-being. And for that reason, I guess what we would need to start doing, besides looking at living wage, which is huge, benefits. Do I even have access to an EAP? Do I know what that is? Is it culturally appropriate for me, what's being offered to me? And I need to really um, think about, well, what can I at least provide through the work, right? What can I give that can can augment what individuals need that will bring bigger well-being, greater well-being. Certainly, providing community food. I know, a number of organizations that are, really providing food to their staff, which is really sad when you think about it, because it means that their pay, isn't quite enough to cover that in today's expensive world. Similarly with housing. And so thank you. I mean, I just love these questions because there's no answers to them. And I think it continues to show the vulnerability we have among so much of our workforce and how hard it is. But I do think we have to really remind ourselves the basics. Something like I don't know, a Fitbit, yay, I don't care. I don't even have I'm walking a ton to catch the bus to get to work or whatever it might be. So thank you for bringing that up.
Thank you so much. Another question. We've got lots of questions, so
Yeah.
thank you, everybody. Years ago, at a public utility I worked for, they had an industrial psychologist to help establish work crews and to assist employees when dealing with customers. Do you think we'll start to see more industrial psychologists employed by businesses?
Absolutely. And I think those organizations large enough are already doing that. It's a great call out. Early, kind of maybe when I first started working total worker health, I thought, oh my gosh, if I do it over again, I do occupational psychology. And I don't know if that's true, but I do think that I love that you pointed this out. And it really helps us see that we are part of this multidisciplinary nature. And it's not to say we need to know it all. In fact, we don't. But thank you. Great, great example. So I guess yes is my answer. And it comes down to costs and priorities in some organizations and access. And think about, I would give a huge shout out here to those schools that exist. I know there's one at Portland State University in occupational psychology where you have a lot of grad students looking for projects. And I'm sure in each of our states you could find that. So great call out.
Great, thank you.
Can I comment on one that I
Oh,
see on here?
absolutely. Yeah.
I want to go to, and anybody that didn't get, I mean, if you think I have an answer for you, feel free to email me if I don't get to this. But I really like this one with Total Worker Health. What do you think of encouraging workers to be aware of the 988 crisis lifeline and mental health resources? I, um, to do work, I mean, in today's world, we absolutely should be informing all of our employees, contractors, whoever we have touch with, community partners about the resources that exist, really help to reduce the stigma around mental health challenges. Again, shout out to the construction industry around the country that has really taken this on with their suicide prevention strategies and mental health. So absolutely, I would put that in my new employee orientation. I would make sure my supervisors understand the resources, the QPR training availability for some groups. So thanks for bringing that up. And it really is kind of working towards that reduced stigma and helping families understand it as well.
Thank you so much. And thank you again to everyone who's entered all of these awesome questions. I see there are a number that we aren't going to get to today, but there's an open invitation to reach out to Dede directly if we missed you. I would like to close with one final question. Are you aware of any research that shows that total worker health efforts by an employer will yield better productivity, that there's a benefit to the bottom line in some way? I wonder more broadly how we encourage employers to adopt the total worker health approach who are not intrinsically motivated by the health and well-being of their workers.
Thank you. Great question. And we know in many cases, this is what it takes. And early on, there were a number of studies that looked at the return of investment, and those are still existing. So I know I'm going to get cut off in a second. So go to NIOSH. under their business case. And there's a number of studies listed there. But what I would also say is remember value of investment, because some of those things are really hard to measure. So we're looking at turnover. We're looking at, satisfaction. Yes, and there's probably some newer data I'm not even aware of. So great, great point, and I would absolutely get loaded with that.
Awesome. Well, thank you so, so much for your time today. We really appreciate you joining us. We also appreciate all of our attendees online. Thank you for being here. Thank you for your amazing questions. As a reminder, this was recorded, so I'll be making the recording available in the next 5 business days. You'll also get an email with a link to the evaluation for your certificate of completion. So thank you all so much for being here today, and I hope you have a wonderful rest of your day.
Thank you, everyone.